Polycythemia is a disease that's characterized by an elevated number of red blood cells. The elevated number of red blood cells can cause hypervolemia or hyperviscosity of the blood. The pathophysiology of polycythemia is there are two kinds. The first one is polycythemia vera, which is a mutation of the JAK2 gene. And the JAK2 gene is responsible for making a protein that promotes the proliferation of cells, and especially the blood cells from the hematopoietic stem cells. Then secondary polycythemia, it can be hypoxia driven, which is a physiological response to certain illnesses such as lung disease or high altitude to cardiovascular disease or tissue hypoxia. And then you have hypoxia-independent secondary polycythemia, which is due to a cancer or a benign tumor that stimulates the making of erythropoietin. The risk factors for this disease are the gender. It is predominantly found more in males and in persons of 60 years or older, and also exposure to radiation can increase the risk for developing polycythemia. The clinical manifestations of polycythemia vera are characterized by the hypertension, which is caused by hypervolemia and the hyperviscosity, and these include headache, vertigo, tinnitus, dizziness, and visual changes. Other symptoms that are associated can be generalized pruritus or itching, and erythromyalgia, which is painful burning or redness of the hands and the feet, and paresthesia, which is numbness or tingling. Other more serious causes can be a stroke due to thrombosis. The patient can also develop gout or hyperuricemia due to an increase of uric acid, which results from the red blood cell destruction. Petechiae, bruising, and nosebleeds can result from vessel rupture due to overdistension or inadequate platelet functioning. Treatment includes phlebotomy, myelosuppressant agents, or hydration therapy. The phlebotomy is used to decrease the blood volume and viscosity and bone marrow activity by taking 300 to 500 mL during the first few days of treatment. Then every 2 to 3 months, 500 mL will be removed to keep the hematocrit levels at less than 45%. Myelosuppressive agents can be taken such as hydroxyurea or ruxolitinib, which inhibit JAK2 mutation. Hydration therapy can help reduce the blood's viscosity. Lastly, you have nursing interventions. First, the nurse must educate the patient on medication. The nurse must also assess the fluid intake and output, since fluid overload or deficiency can cause the blood to become more viscous. The nurse must also assess the nutritional intakes. This can be because certain symptoms of the GI, such as fullness or pain or dyspepsia, can result from inadequate food intake. And lastly, the nurse must promote lower extremity exercises or ambulation to decrease the chances of thrombus formation. The nurse may also have to assist in the phlebotomy procedure.